So we have this question: XDR typhoid is sensitive to which drug? Before understanding the answer, let's see some of the theory part. That when will you say that a patient has a complicated typhoid fever? If any of these GIT symptoms are present, like the patient has persistent vomiting or the diarrhea, or if there is abdominal distension, or if there is intestinal hemorrhage, if any of them is present, we'll say that it is a complicated typhoid. And some patient we take them as a complicated one, for example pregnant or extremes of age, immunocompromised patient like severe diabetes, or patient after renal transplant, and if the fever not responding after 5 to 7 days of the treatment. Second, if there is systemic involvement in the form of encephalopathy, that is brain is involved, myocarditis, that is heart is involved, pneumonia, that is lungs is involved, hepatitis, that is liver is involved, or acute kidney injury. So if any of these is present, anyone, we will say that it is a complicated typhoid. Otherwise we will say that it is a uncomplicated typhoid. Now in uncomplicated typhoid, what will be the drug of choice? Drug of choice, if you have to give oral, it is azithromycin, and if it is IV, you have to give ceftriaxone. What drugs you don't have to give, which is frequently prescribed by the doctors, it is fluoroquinones. Why? Because there is a widespread resistance and there is a development of DSC strain. DSC means there is a decreased sensitivity to ciprofloxacin, so they will be positive, they will be sensitive to the drug, that when you will do the culture they will be positive to the drug, but actually they will not respond to the drug. So these strains are called DSC strains, so they are not recommended as initial therapy. CAT group of drug, that is chloramphenicol, ampicillin, or trimethoprim sulfamethoxazole, these drugs are also not given because they have developed resistance. Also, why cefixime is not given? Because there is increased treatment failure risk, because most of the time when you give cefixime, a lot of the patient, there is no symptom relief, and thus we have to shift to the other drugs. Also, the time taken to make the patient afebrile is longer with the cefixime. So this is from the latest Harrison. So now coming to the complicated typhoid, what will you do in cases of the complicated typhoid? The drug of choice for the complicated typhoid is ceftriaxone, but we have to understand very important drug resistance that is emerging in typhoid, that is anemonic cat fuck. So what is C for chloramphenicol, A is for amphenicol, T is for trimethoprim, F is for fluoroquinones, and C is for ceftriaxones, and next is for cefixime. If if initial three of the drugs are resistant, then it is called as MDR-TB that we are talking about. And if the typhoid is resistant to all these drugs, then it is called as